Laurie Shaw. Welcome to another Professionals Under Pressure conference video update. Today, Laurie and I are really happy to have with us CASA's Principal Medical Officer, Dr. Kate Manderson. Welcome, Kate, and thanks very much for being with us.
It's my pleasure. I'm very pleased to be here and to be part of this really important conversation.
Thanks, Kate. And although we're running the conference in honour of Robert Dull, who, as you would see from a previous video we talked about and was sadly lost in an aircraft accident in early 2020, and we'll be hearing from his son Nathan on the day of the conference. Although we're running the conference in honour of him, we also wanted to talk about other types of pressure apart from that more dynamic type of pressure and decision making that can happen when we're flying. We also wanted to talk about some of the mental health pressures, although unrelated to Robert, that come into play for us as pilots and professional aviators. So I think Kate will be really good to talk about that, and we're going to ask her a few questions shortly, or Laurie will. But before I do that, let me just introduce her to you with the bio. So Dr. Kate Manderson started her career in aerospace medicine in 2001 as a junior medical officer with the Royal Australian Navy. She completed her postgrad studies through King's College London and the RAF, and went on to become a Foundation Fellow of the Australasian College of Aerospace Medicine. Dr. Manderson is also a Specialist General Practitioner and a Fellow of the Royal Aeronautical Society and the Aerospace Medicine Association. Having almost completed 2 terms as President of the Australasian Society of Aerospace Medicine, Dr. Manderson started as CASA's Principal Medical Officer in the middle of 2021 and works closely with DAMEs and the aviation industry and the community on aviation medicine matters. On the rare occasion she's not at work, Dr. Manderson might be found either somewhere snowy or somewhere beachy with her husband and 2 daughters. And Kate, you're obviously speaking to us from a respiratory clinic in the middle of another COVID wave. I don't know whether you've managed to find somewhere beachy or snowy in the last few months to relax. It doesn't sound like it.
It's a hard one to do. I'm lucky enough to live in a beautiful part of the world down in the Jervis Bay area. So when I get the opportunity to take a moment and to de-escalate myself, often that might involve walking along the beach and taking some deep breaths. So I find it where I can.
And well, like I said before, our hat goes off to you and we salute you guys, and everyone in your field are really, I think, holding the country together at the moment. So thanks for all that extra time and extra hours and all the extra stress you're enduring on our behalf. We really appreciate it. Now, Laurie, I believe you already know Kate from your work in the HIMSS space, and you might even want to just quickly talk about HIMSS for those that may not know. And then I'll hand over to you to chat with her and ask a few questions, if that's okay.
Yeah, thanks very much, Parky, and good morning. Good morning, Kate. It's great to see you again. Kate and I got to know each other, quite a few years ago now, Parky, at one of the ASAM, which is the Australasian Society of Aerospace Medicine conferences. I think it was, or maybe back in 2016, I think it was. So it's quite a few years ago now. So it was a real eye-opener for me. The Australian DAMEs, or Designated Aviation Medical, pause. The designated aviation medical examiners, great bunch of people, very practical, and I was very at ease as soon as I was introduced into their conference and started talking about HIMSS. Now, HIMSS is an acronym for the Human Intervention Motivation Study, which was formed in the United States way back in 1974. And mainly it what it does deal with in those days was substance misuse, and mainly pertaining to alcohol. They found that a lot of guys coming back from Vietnam or even the Korean conflict, there's a lot of trauma associated with that. So alcoholism was actually not prevalent, but it was there in the workplace. And back in those days, it was just career-ending, full stop. So the unions and the regulator and the medical community got together and came up with a program. So it was basically around supervision to get the pilots back to work and its crudest form, I guess we could call it a peer support program. So it was more supervisory back in those days. I think we've learned a lot more in the decade since on how substance use disorder comes about. And with a great collaborative effort we've established in Australia, I think, and around, especially around peer support in the airlines. But Kate will be talking more at the conference as well about in support in general aviation as well. I think we can make some great inroads into understanding this better and making the community more understanding about how substance use disorder or misuse, and we're seeing a lot more drug use these days as well in the community at large. We can manage it and just accept it, that it's part of life, and we get on with it. So the HIMSS Australia Advisory Group has been formed quite a few years ago as well now, and it's also a collaborative effort between industry. And the current president is Andrew O'Mealy. Andrew's a great guy. So anyone, you're able to go in confidence at Andrew and his team, and I'm still on that team as well, to have a discussion in confidence if you have issues or a friend has issues with drugs or alcohol. You won't be dobbed in. We just don't operate that way. So it's something that we feel very proud of, that we've established, and it's gaining traction too, and gaining trust, and that's the main thing. So, Kate, yeah, thank you very much, and we really do appreciate you making your time available today. I can see in your scrubs there. I know how busy you are, and also thank you very much for making your time available to come up to the conference on the 26th of Feb. So, I've just got two questions for you, well, two and a half really. So, and this is more broadly about mental health, and which is very prevalent at the moment, especially after the last 2 years in our industry and indeed in our pilot community. So generally, when pilots hear the words mental health, it goes in the ear as mental health from the DAME or a manager or whoever. But what the brain interprets is mental illness. So the brain automatically catastrophizes mental illness into loss of medical or medical certificate from CASA, which of course that's been traditional, and we all understand that. And there's probably some precedent to that in decades beforehand. We didn't really understand all this sort of stuff. So there's actually two parts of this question about this. What are your thoughts on that? And the second part of that question rather, is how can we help as an industry and break down that stigma?
So you're spot on with the traditional understanding of mental health, mental illness, mental well-being, all being conflated as a disease, and there's something wrong with you, and that couldn't possibly be safe, and you're grounded. And what that is I suppose it's a legacy of the broader medical sector plus community understanding of mental well-being and mental illness. The stigma associated with any declaration of me not being quite right up here in terms of how I'm coping or feeling it's been brushed under the carpet, it's been marginalised, it's certainly nothing that you talk about. We lock people away if they're like that. So that's the legacy that we're left with from all of that tradition. And as you rightly say, we now have a much better, more well-developed understanding of the continuum of health and well-being, and it's not a black and white of you're sick or you're well. It's a continuum from being as well as you can be to being profoundly unwell. It's not a one-way street either. You can be a little bit unwell and then get better along that continuum. And we do put gates on that line to draw out that analogy. We put gates on that line, and some of them are a little bit artificial, but we've got to do it somewhere. We're beyond a certain point. We would say someone is unwell, and we make a diagnosis and we initiate a treatment program. But before that and around that, there is a whole line of the concept of being well, being a little unwell, being distressed, and where help seeking as a preventive activity will hopefully either slow the progression or even stop the progression towards that diagnosis gate, and bring people back from that as well. So that's the current philosophy now, is that there's a lot more to it than the binary well or sick. And we are bringing that across into the regulator space as well as in the general medicine space, to say that to our certificate holders and to our DAMEs, that if someone puts up their hand and says, I've been a bit distressed and I've been getting help for that distress, we treat that the same as if you had a sore knee and you saw a physio. I'm not going to ground you for that. I had a sore mind and I saw a counsellor. I'm not going to ground you for that. Now, if your physio then diagnoses a problem and you have an MRI and you need to have surgery, well, that's different, of course. And we'll look after you for that. And the end state for that, guess what, is we're probably going to get you back to flying again, whether it's for a total knee replacement or for a period of mental health, mental illness treatment. The continuum comes back the other way, and we're going to get you back to flying for that as well. And that is the mantra that people are probably going to, I hope people get sick of hearing me say this, because by then it will have been bedded in. Mental well-being, mental distress is normal. It's okay not to be okay. It's okay to seek help. It's okay to accept help. And that is the new normal for us.
That's great. Thank you very much, Kate. It reminds me of a quote from Dr. Rhys Simons up in the European Aerospace Medicine, where he says that after extensive studies and surveys, it's been revealed that pilots are in fact actually human. So it's and we are. I think especially after the last couple of years, and I've been caught right in the middle of it as well. This whole COVID thing, there's not too many good things that have come out of it, if any at all, but one is greater awareness of mental health issues, and we are now talking about it. And we are normalising it, because it's like many things in life, as over the years where they've been stigmatised and it's not been allowed to happen. It's not the way you operate. Now all of a sudden going, yeah, you know what? This is normal, and we can actually manage it. So that actually leads me into my next question, Kate. So, in my current role that I'm doing, I'm observing, and again, as I keep saying, this is quite normal. I'm observing a lot of anxiety. What could be termed as anxiety, I can't diagnose. That's not my role, but it doesn't take a rocket scientist or a clinical psychologist to figure all this out. So that there's an increased anxiety, or you could even go as far as to say there's a bit of chronic anxiety going on in the workplace, and not just amongst pilots, but right across the industry, especially the airline industry, which has been decimated globally. So, and I do work with global bodies in this area. So it's not just Australia, it's UK, USA, and all those sort of places. So so there's very little evidence available on anxiety and mental health issues, for the very reasons we just talked about and you just talked about before. So there's very scarce data out there, and I come from a critical incident stress management lens when I view all this sort of stuff. It all starts in the nervous system. And as you've been talking about, Kate, with I'm reminded of Viktor Frankl, whose great quote is, "An abnormal reaction to an abnormal situation is normal behaviour." So, with my question on that, I said, do you have any advice on how we can all educate industry, that's pilots and industry in particular, or in general rather, on that anxiety is not actually a dirty word?
So, I think we just need to keep doing what we're currently doing, which is keep talking about it so that it becomes socialised and then normalised. We do need champions. We need people who say, this happened to me and look at me now and I'm okay. Because I think we do, when we identify in other people who we hold in high regard or who we respect, we see that that person has had an experience of distress that they've worked through. We can say, gosh, well, if they did that and they're willing to claim and own that that was their experience, then perhaps I can do that too. So we have champions that lead by example. We have people like exactly what we're doing now. We're talking about it. We're putting it out there. It's coming up in conferences and meetings. That trickles then across to broader media and to broader understanding. We have to maintain that message so that it doesn't get left behind, as it sometimes can. And like you said, that making lemonade out of the epic lemon that is COVID, we do have an opportunity to talk about this a lot more. It's not a short, sharp, isolated event like, for example, the bushfires we experienced in my part of the world in 2019. It wasn't too long after that we'd say, oh, well, the fires are out now, so we're all good. The COVID fire is not out. And what that has done is given us some momentum to keep this conversation going, whereas the end of the fires almost ended the conversation about how that affected our community in a broad sense. The other thing that we need to be doing, which I think we are doing with some success, is getting leadership involvement. So that's where we have at the higher levels of organisations. So, for example, in the airlines, we've got the board and the directors and the CEO committing their resources, committing their time and their effort, but their resources, their finances, their people, to being able to continue this, allowing us to have conferences and meetings and go to things, bringing it inside the workplace. And I know we've done quite a good piece at CASA that we're working on even more now, is the It's Okay Not to Be Okay, to steal that from the Lifeline organisation, and keeping that going. the concept of having mental health first aiders in your workplace. Just like we can do CPR on someone if they fall over, you don't need to be a cardiologist for that. If you're a mental health first aider, you can sit down and talk to someone and help them through their distress. And you don't need to be a psychiatrist or a doctor or anything to do that either. And that integration in workplaces, the normalisation of that in workplaces, that needs the leadership to buy in. And Laurie, people like you and I in the ear of leadership and maybe taking a role in leadership is how we're going to keep that going.
Thanks very much, Kate. There's some awesome takeaways just in those few comments there that you mentioned. And my current employer is absolutely fantastic. I mean, right from the top, it's we need this, and they're not scared to spend a few dollars, and quite a few dollars, in fact. So, which is great. And I think this is we're marching more towards the evolution of understanding mental health as not the dirty word, as I hear all my pilot colleagues say it is. So thank you very much for that, Kate. It's much appreciated, and looking forward to seeing you on the 26th of Feb.
Absolutely. Very much looking forward to it as well. And thanks again for the opportunity.
Thanks very much, Kate, and thanks, Laurie. And I really like your parallel there to mental health almost as a broken limb. We would definitely seek help if we did have a broken arm or a broken leg. And so I think the same needs to happen here. So some really good insight, and we're really looking forward to hearing more from Kate in the future in this space. So thank you. If you want to register for the Professionals Under Pressure conference, you can do so at the website, which is just Professionals Under Pressure, all one word, professionalsunderpressure.com. There's an Eventbrite link there, and for $35, you'll get to hear from people like Kate and many others. So go ahead and register. You can also make comments or ask questions on there. So stay tuned there for any late-breaking changes as well to the conference, and hopefully see you Saturday, 26th of February.